We have published peer-reviewed phase 2 data showing 82% slowing of the disease of Alzheimer's in mild to moderate patients and over 80% on all other relevant secondary endpoints.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. We're here at AAIC, and I'm with Ken Mariash, the CEO of Synaptica. Ken, why don't you walk with me? So,
glad to be here, Logan.
Talk to me about what you're doing with Synaptica. You are innovating in brain modulation, neuromodulation in a really interesting way. So give me the overview.
Yeah, it's a non-drug, personalized neuromodulation approach. We're stimulating a region of the brain that's associated with episodic memory, which is strongly implicated in Alzheimer's. And we do that in a really personalized way. So we find the right spot on the brain for every patient that gets the right engagement of the networks that are related to memory. And we have published peer-reviewed phase 2 data that is unprecedented, showing 82% slowing of the disease of Alzheimer's in mild to moderate patients and over 80% on all other relevant secondary endpoints.
82%, those are high numbers.
They are.
How has the industry responded to this research?
With excitement and also with surprise. Because nobody thought that a neuromodulation approach could induce such remarkable changes in the brain. And, we just published imaging data that shows that we do just that. Our stimulation therapy literally remodels the brain on the micro, macro, and connectome levels. We're literally remodeling the brain and building new connections in the functional networks that are associated with memory.
What have been some of the challenges associated with advances in neuromodulation up to this point? It's a field that maybe has struggled to get acceptance. Is that fair to say?
In many areas of medicine, neuromodulation has really disrupted various disease states. It's a major industry. It's a $7 billion industry. So Parkinson's, for example, well established. Spinal cord stimulation for pain, very well established. Sleep apnea, overactive bladder, I could go on. There's lots of different ways where neuromodulation is displacing or working with existing drugs. And so we see this as no different. We know that neuromodulation induces neuroplasticity in the brain. The question is getting it into the right spot. And so you asked about struggles with neuromodulation. The struggles have been with precision and lack of personalization. So lack of precision, lack of personalization. We bring both of those to the table. So where you stimulate turns out really matters in the brain. Everybody's brain responds differently. So personalizing the stimulation to hit your networks that are related to memory and not some other network related to, say, attention or the salience network or the language network or the visual network. We need to hit the right network. And so the location and the intensity of the stimulation needs to be specific for each individual.
Okay. Let's talk about some of the interesting opportunities and challenges related to going to market with a device. You actually have to do the neurostimulation in an office. So talk to me about kind of where you envision people getting this care and what that looks like. Is it every day, every week, every month? How do you do it?
Yeah, so the drugs like lecanemab and donanemab are infused already. So the patient already has to come in for a 90-minute infusion every 2 weeks, for example, with lecanemab. With our therapy, it's a 20-minute painless stimulation session in a doctor's office. And so it does involve training the staff on how to use the machine. It's not that complicated. It's similar to an MRI tech. TMS for depression is a very well-established therapy. Something like 40,000 patients get TMS therapy for depression every year. And so we're building on an infrastructure and an awareness and a safety record that's already there. So it's not a challenge that hasn't been surmounted in other areas of medicine. We know that TMS works in depression. The question is, can it also work in this disease state? And so far with the phase 2 data from 2 phase 2s that we have, so far the results are really, really promising.
Obviously, we're here at AAIC. Any responses here from the research that you're presenting?
A lot of excitement on this imaging paper. Yeah, because what it shows is, and you might ask the question, it's a good question, which would be, are you just giving patients a temporary boost? Like a caffeine boost or a sugar high to spike the levels of cognition and function in the brain? And we're not doing that. We're actually remodeling the brain. We're seeing true evidence of neuroplasticity in the brain. We see with fMRI, new connections built in the brain. We see with structural MRI, we're preserving gray matter. At a micro level, we show that we're preserving the columns, the mini column structure, the architecture of the brain. So we're literally remodeling the brain, similar to, for example, remodeling the heart in heart failure or heart disease.
Where do you see this going? Because I want to remodel my brain. I feel
Sure.
like I'm forgetting things. Like, where does this go beyond Alzheimer's?
It's going to go up to MCI, so get to patients earlier. Why would you wait until you had stage 3 cancer before you treat it, right?
Yeah.
We want to get to patients before they have symptomology that's too advanced. And then beyond that, who knows? We could go into many disease states other than Alzheimer's, anything neurodegenerative. In fact, anything involving a circuit in the brain that we need to probe, that's a disease state we could go after. You know, the fundamental technology that we use is TMS, but it's also paired with EEG. And so what we do is we ping the brain with single pulses. It's like active sonar of the brain. That reveals so much about the connectome in your brain, how the different nodes of your brain are connected. When you pulse the brain, it's like dropping a pebble into the pond, and it reveals the topology of the pond, so to speak.
Wow.
So we know that we're hitting the right targets when we do that TMS EEG, but it generates a barrage of data, a huge amount of data that we need to parse. And we know how to do that. We've built the algorithms that enable us to parse that data to know that we're hitting the right target and not the wrong target. So it is a data aspect too.
Yeah. Which sort of means we've come to this moment. Now we're ready for this kind of innovation because we have the ability to crunch that data.
Yes, we do.
We have
ML.
the tools. Yeah, exactly. So last question, what are you looking forward to most? What should we be looking forward to from Synaptica this year?
You should be setting your calendar. October 31st in Madrid at the CTAD conference, we will present data from our second phase 2 with a 1-year endpoint. And I can't tell you too much about it, but it's going to be very exciting data.
That's cool. Okay, we'll be looking
Mark
for
your
it.
calendars.
Okay, thanks Ken.
All right.
Hope it's a great conference.
Good to see you. Thanks
All
so
right.
much.